Ever feel like you're just drowning in information? Just facts overload, and you wish there was just a way to cut through it all and really get what's important. If that sounds like you, well, you're in the right place. Here on the Deep Dive, that's exactly what we do. We cut the noise, find the core insights, and get you up to speed fast. And today we're jumping into something pretty fascinating and, honestly, a bit weird, a bit paradoxical, especially in the world of animal health. We're talking about Actinobacillus suis, ASUS for short. It's this bacteria that affects pigs, but how it kind of emerged. Well, it tells a really surprising story about modern pig farming.
It really does. It's a great case study, actually. It shows how sometimes our best efforts in trying to improve animal health, make things cleaner, higher health, how that can accidentally sort of create an opening for a bug like E. coli, an opportunist.
An opportunist. Right?
Yeah, some people even call it a disease of health, which, I mean, that phrase alone kind of tells you there's a paradox here we need to dig into. We'll be pulling this straight from the science, the research papers, the data you shared.
Okay, so that's our mission for this deep dive. Untangle ASUS. Where did it come from? What does it actually do? The symptoms, which sound like they can be all over the place.
Yeah.
How to diagnose it accurately, which is tricky. And then, how to actually manage it. By the end, you'll have a really clear picture of this master mimic and why it matters. Ready to jump in?
Let's do it.
Okay, so let's start with the history, because that really sets up this whole paradox thing. ASUS.
It was first described, way back in 1962.
That's right, 1962. And back then, yeah, it was considered pretty minor, just an opportunistic thing, secondary importance. Popped up now and then, mostly in young pigs, sporadically. Not a big headline.
Right, not the main event.
Definitely not. But then, things started to shift, big time. Since the 1980s, its clinical impact, the number of cases reported, it shot up, especially North America. And this lines up really strongly with the big changes in pig farming, these modern intensive systems. High health status herds, SEW, SPF.
High health status, segregated early weaning, specific pathogen-free.
Right.
The really clean systems. Exactly. The very systems designed to improve health. It's kind of ironic, really.
Okay, so here it is, the disease of health paradox. How does being too clean cause a disease? That sounds backwards.
It does sound backwards, but think about it like this. These high health systems were incredibly successful at getting rid of the major endemic diseases. The big players like APP, Actinobacillus, pleuropneumoniae, and mycoplasma.
Okay, wiped out the usual suspects.
Right, but doing that created, well, you could call it an immunological vacuum, and a microbial one too. The pigs in these super clean places, they're immunologically naive. They just haven't seen the usual range of bugs that would normally kind of train their immune system.
Ah, so their immune systems aren't primed.
Exactly. And ASUS, it's often just there living harmlessly in the background, a normal resident.
Yeah.
But now with the competition gone, and in these naive pigs, if they get stressed, ASUS faces very little pushback. It can just explode, proliferate, and you get these really severe outbreaks.
Wow, okay, so let's get specific. What is Actinobacillus suis biologically? What are we looking at under the microscope, so to speak?
Okay, basics. It's a gram-negative bacterium, non-motile, so it doesn't swim around. It looks like a tiny rod, or maybe somewhere between a sphere and a rod, a cocobacillus. Part of the Pastoralaceae family. It's also a facultative anaerobe, meaning it's flexible, it can grow with oxygen or without it. Pretty adaptable.
And how do you spot it in the lab?
Grows pretty readily on blood agar. And it typically shows beta hemolysis, those clear zones around the colonies where it breaks down the red blood cells. That's a key visual cue. But here's a really crucial diagnostic point. It does not need NAD nicotinamide adenine dinucleotide, sometimes called V factor, to grow.
NAD independent. Why is that so important?
Because that's a key way we tell it apart from its close relative APP biotype I. APP needs NAD. So if you've got something that looks like APP but grows without NAD, you start thinking ASUS. It's a critical differentiator.
Gotcha. And biochemically, any other telltale signs?
Yeah, a few typical reactions. Usually oxidase positive. It ferments certain sugars like lactose and trehalose, generally negative for L-rhamnose. And the strains found in pigs, the porcine isolates, are usually mannitol negative. These little details help pin it down.
And it's not just in pigs, right?
It's interesting too, yeah. It's been found in horses, cattle, sheep, goats, dogs, cats, even wild birds. But genetic studies show the pig strains are pretty distinct. They seem to have adapted specifically to pigs.
Okay, so we have this adaptable bug living quietly, but with the potential to cause chaos in these clean environments. Let's dig into that dual role. How does it flip from harmless to harmful?
Right, that's the million-dollar question with opportunists. So A. suis is a normal resident, often found on the upper respiratory tract tonsils, nasal passages of perfectly healthy pigs. Suis are usually the main reservoir in a breeding herd. They can carry it, pass it on, without showing any signs themselves.
So the mothers pass it down.
Often, yeah. Piglets usually pick it up from the sow right around birth or shortly after.
Yeah.
Through vaginal secretions or respiratory droplets, it gets in early. Surveys show it can be really common, like 16% to sometimes over 90% prevalence in healthy herds. It's definitely around.
A real Dr. Jekyll and Mr. Hyde situation.
You could say that, yeah.
So if it's already there, how does it spread like wildfire during an outbreak?
Well, that initial colonization might be vertical, so to piglet. But the main driver for spread within a group causing those outbreaks is horizontal transmission. Pig to pig, mostly through nose-to-nose contact, and breathing in infectious aerosols, droplets from coughing or sneezing carrier pigs. It can also get in through skin wounds.
Okay.
And pigs that get sick and recover. They can become long-term carriers, shedding the bacteria, keeping the cycle going. Fomite transmission spread via contaminated objects, boots, equipment seems less important because the bug doesn't survive that well out in the environment.
Right. Which brings us back to the trigger. What flips the switch? What makes this quiet resident suddenly go rogue?
It's usually not just one thing. It's multifactorial. But like we said, the biggest predisposing factor for those really bad outbreaks is that high health status. Those immunological naive pigs are just sitting ducks, unfortunately.
So their cleanliness makes them vulnerable. What else pushes it over the edge?
Stress. Stress-induced immunosuppression is huge. Think about all the standard stressors in production. Weaning is a big one, farrowing for the sows, transport, mixing pigs, overcrowding, bad ventilation, sudden temperature changes. Any of these can weaken the pig's defenses just enough for A. suis to take advantage.
Timing matters too, right? With the antibodies from the mother.
Absolutely. There's often this window of susceptibility in weaned pigs. It's when the maternal antibodies they got from the sow's colostrum start to wear off, but their own immune system hasn't fully kicked in yet for this specific bug. Usually around 8 to 12 weeks old, you see the lowest antibody levels. That often lines up with when we see clinical signs appear.
And other diseases playing a role. Co-infections.
Major trigger, yeah.
Yeah.
If a pig's already fighting something else, especially a virus that suppresses the immune system, like TRRSV, porcine reproductive and respiratory syndrome virus, a really common and nasty one.
Right. PRRS is everywhere.
It really is. So if PRRS is compromising the pig's immune defenses, it just rolls out the red carpet for A. suis to invade and cause systemic body-wide disease.
Okay, so the defenses are down. A. suis gets its chance. What weapons does it use? How does it actually cause damage once it turns pathogenic?
So once it decides to invade, it typically moves from the upper respiratory tract, maybe through the tonsils, gets into the bloodstream, that's bacteremia. Then it multiplies in the blood, causing septicemia, a full-blown systemic infection. From the blood, it travels everywhere, lodging in small blood vessels in various organs and causing damage there that's hematogenous spread.
And the specific tools it uses, you mentioned toxins.
Yes, key virulence factors.
Yeah.
First up are the Archaex toxins Apex-I and Epex-I. These are nasty. They're shared with APP, its cousin. They're pore-forming cytotoxins.
Pore-forming, like punching holes.
Exactly. They punch holes in host cell membranes, the cells lining blood vessels, immune cells like alveolar macrophages. This causes massive damage, cell death, bleeding, leading to those severe necrohemorrhagic lesions we see, tissue death and bleeding. Some studies even suggest strains with more copies of the RTX genes might be more virulent.
Wow. What else?
Adhesins. Things like type 4V fimbriae, outer membrane proteins like POLMA. These are like little grappling hooks that help the bacteria stick to the cells lining the respiratory tract, which is crucial for that first step, colonization.
Makes sense. Needs to hang on.
Right. Then iron acquisition systems. Iron is essential for bacteria, but it's tightly locked up in the host. A. suis has clever systems, receptors for transferring hemoglobin, to basically steal iron from the pig.
Resourceful.
Very. And finally, it's the capsular polysaccharide, or CPS. This slimy outer layer is super important for evading the pig's first line of defense, the innate immune system. It mainly works by preventing phagocytosis, stopping immune cells from eating the bacteria.
Okay, quite an arsenal. So we know what it is, how it gets triggered, how it attacks. What does this look like in the pig? Let's talk symptoms. You said it's a master mimic.
Exactly. The clinical signs are incredibly variable. Depends hugely on the pig's age, its immune status.
Let's start with the little ones. Suckling piglets, weaned piglets under 3 months.
Right. In these young pigs, you often see peracute or acute septicemia, meaning it hits fast and hard. Sudden death is common, sometimes with almost no warning signs. If you do see signs, it's typically high fever, the pigs are really down, lethargic, won't eat, anorexia. Severe respiratory distress that labored breathing farmers call thumps.
Numps, right?
You might see cyanosis, that bluish tinge on the ears, snout, belly, because they're not getting enough oxygen. Neurological signs can happen too if it gets to the brain lining, causing meningitis. So tremors, incoordination, paddling legs.
And joints.
Yes. Polyarthritis is common. Lameness, visibly swollen joints. It's really tough on them. Mortality can hit 50% in affected groups. It's devastating.
And if you were to do a necropsy, what would you find inside?
The lesions really point to that septicemia, that systemic spread. You'd see widespread small hemorrhages, petechiae, and larger blotchy ones, ecchymoses, on surfaces of organs. The kidneys often have this classic turkey egg look because of all the pinpoint hemorrhages.
Turkey egg kidney, okay.
Yeah. Also, an enlarged spleen, splenomegaly. Inflammation lining the body cavities, that's serifibrinous polycerositis, fibrinous polyarthritis in the joints, and scattered pneumonia caused by bacterial lodging in lung capillaries, multifocal embolic pneumonia.
Okay, that's the young ones. What about older pigs? Grower finishers, say 3 to 6 months old?
It's less common in this age group, but when it hits, especially in those high health herds, it can still be really severe. It can be a septicemic again, or maybe more localized. Respiratory signs are pretty common. Coughing, difficulty breathing. Looks a lot like APP, which makes diagnosis tricky just based on signs.
The mimicry again.
Exactly. And sometimes you see these skin lesions. They can be sort of diamond-shaped, rhomboid, or just irregular reddish patches. They can look very much like swine erysipelas, another bacterial disease. But it's inconsistent. You don't always see them. Lameness from arthritis happens here too.
And the internal lesions in these older pigs.
Similar to the piglets, the septicemic signs, the joint inflammation. But the pneumonia might be more severe, more necrotizing, meaning more tissue death in the lungs. And inflammation of the lung lining, fibrinous pleuritis, is pretty common too.
What about adult pigs? Sows and boars.
Clinical disease is rare in adults, but it can happen, usually as acute septicemia leading to sudden death. Or maybe pneumonia, fever, not eating, lethargy.
Yeah.
In pregnant sows, it can cause abortion. And it's also been linked to chronic mastitis, long-term udder infections. Lesions would reflect that septicemia, pneumonia, maybe bad mastitis.
Okay, so putting all these different signs and lesions together, it really paints a picture of systemic infection, right? Something getting into the blood and spreading everywhere.
That's exactly right. And histopathology, looking at the tissues under a microscope, confirms it. You see the damage is centered around small blood vessels in all sorts of organs. Those vessels are often plugged up with bacteria, bacterial emboli or thrombi, and around them you see inflammation of the vessel walls, vasculitis, clotting, thrombosis, tissue death, necrosis, and bleeding hemorrhage. That widespread vascular damage is the key signature of how A. suis causes disease systemically.
Okay, I can definitely see why you'd call it a mimic. With all those overlapping signs, respiratory issues, skin lesions, joint problems, sudden death.
Yeah.
A presumptive diagnosis based just on looking at the pigs must be really tough. You'd need the whole picture, the herd history.
You absolutely do. The epidemiology, like you said, a sudden bad outbreak in a high health herd, hitting multiple age groups combined with those clinical signs, that might make you suspicious of A. suis.
But suspicion isn't enough.
Definitely not. Laboratory confirmation is essential because it is such a great mimic. Getting it wrong means using the wrong treatments, the wrong control strategies, like wasting money on an APP vaccine that won't work for A. suis, or maybe using penicillin thinking it's erysipelas when maybe A. suis needs something different or has resistance. It leads to ongoing losses and welfare issues.
So what are the reliable ways, the lab tests, the gold standards?
Okay, the gold standard is still bacterial culture. You need good samples, aseptically collected tissues like lungs, spleen, heart, blood, joint fluid from pigs that are acutely sick and haven't been treated with antibiotics yet. You grow it in the lab. And crucially, like we mentioned, you check if it grows without needing NAD. That NAD independence is key to differentiating it from APP biotype I.
Okay, culture first. What else?
Molecular diagnostics, usually PCR. Real-time PCR is great because it's fast, very sensitive, and very specific for A. suis DNA. You can run it on tissues, swabs from lesions, even oral fluids collected from ropes the pigs chew on, which is useful for herd screening.
PCR is powerful. What about blood tests for antibodies? Serology.
Serology is tricky for A. suis diagnosis. The big problem is cross-reactivity. There's significant overlap in the antigens between A. suis and APP, so antibodies raised against one might react with the other, giving you false positives for A. suis if the pig actually had APP, or vice versa.
So not great for individual diagnosis.
Not really. But you can use an ELISA test that's specific for the Aptas V toxin. That toxin is only found in APP, so that test is negative, it helps rule out APP. Serology might still have some use for monitoring herd exposure over time, but less so for diagnosing acute cases.
Okay, this differentiation piece is so critical. Let's really nail down the key differences between A. suis and its main lookalikes. How do you tease them apart?
All right, let's break it down. Comparing A. suis to APP, Actinobacillus pleuropneumoniae. Both cause bad pneumonia, sudden death. But APP is mostly a respiratory disease. The lung lesions are often localized, maybe stuck to the ribs, often in the lower back lobes, diaphragmatic lobes. A. suis is systemic. The lung lesions are typically embolic, scattered throughout, plus you get lesions in other organs, polysericitis. And the lab difference, A. suis is NAD independent, APP needs NAD, and you can use APP-specific PCR ELISA for APS4.
Okay, APP is more lung-focused. What about strep suis, streptococcus suis?
Strep suis is famous for causing meningitis, arthritis, septicemia, especially in pigs a few weeks after weaning. A. suis can do all that too, but meningitis seems much more consistently a main feature with strep suis. A. suis often has more severe lung and skin involvement and tends to affect a wider age range, not just those recently weaned pigs. Lab culture tells them apart easily. Strep is gram-positive, A. suis is gram-negative.
Got it. Then swine erysipelas. You mentioned the skin lesions.
Right. Both cause septicemia, sudden death, arthritis, skin lesions. Big confusion point. But erysipelas can have those classic diamond skin lesions. If you see those, it's almost certainly erysipelas that are pathognomonic. A. suis skin lesions are usually more diffuse, red, or maybe purplish due to the underlying blood vessel damage, vasculitis. Plus, erysipelas is caused by a gram-positive rod and typically responds really well, really quickly to penicillin. A. suis is gram-negative.
Diamond skin for erysipelas. Okay, one more. Glasser's disease.
Glasser's disease, caused by Glasserella parasous. This one causes really severe fibrinous polysericitis inflammation everywhere, lining the chest and abdomen, plus arthritis and meningitis, mostly in weaned pigs. So the gross lesions can look very similar to A. suis polysericitis.
Just how do you tell them apart?
Key differences. Glasser's doesn't usually cause that severe bleeding embolic pneumonia that A. suis does, and it doesn't cause those erysipelas-like skin lesions. Again, you really need lab confirmation culture, or PCR, to definitively separate Glasser's from A. suis.
Okay, so it really takes careful observation of the whole picture age group, specific lesions, especially lungs and skin, and then relying heavily on those lab diagnostics like culture and PCR, paying attention to things like NAD dependence and gram stain.
Exactly. You need to combine the clinical picture with definitive lab work to avoid misdiagnosis.
So imagine you've got an outbreak confirmed, A. suis, things are happening fast. What's the immediate treatment plan?
Speed is critical. Because it can be so peracute, you need to treat clinically sick pigs immediately with injectable antibiotics. They usually have a fever they're not eating, so pills or feed medication won't work well initially for the really sick ones. Parenteral treatment gets the drug levels up quickly.
What antibiotics usually work?
Several classes are generally effective. Beta-lactams like amoxicillin, ampicillin. Cephalosporins, particularly Ceftiofur, are often favored because they work fast and seem quite effective in acute outbreaks. Trimethoprim sulfa combinations, tetracyclines, florfenicol, these are also commonly used. And then for the rest of the group that's been exposed but isn't showing signs yet, group medication through the water or feed is often used to try and prevent more cases and limit spread.
You need to know if the bug is actually susceptible, right? Resistance is always a concern.
Absolutely essential. You should really be doing antimicrobial susceptibility testing on the isolates you get from the farm. There isn't a ton of widespread surveillance data specifically for A. suis resistance patterns. And resistance, especially to older drugs like tetracyclines or maybe macrolides, is definitely possible. You need to confirm what works best for the specific strain you're dealing with.
Makes sense. What about prevention? Are there vaccines?
That's a major gap, unfortunately. Currently, there are no commercially licensed vaccines available specifically for A. suis.
No commercial ones. What about farm-specific ones?
Yes, autogenous vaccines are an option. These are custom-made vaccines using the bacterial isolates collected directly from the farm having the problem. The idea is they should match the specific strain causing trouble.
Do they work well?
Their effectiveness is variable and not really rigorously proven through large controlled studies. It depends on a lot of things, getting the timing right, the quality of the vaccine production, how well the isolate used actually represents what's causing disease now. There's also some talks, mostly speculation, about whether APP vaccines might give some cross-protection because they share those ABOX toxins, but you absolutely cannot rely on that. It's not proven.
Okay, so no magic bullet vaccine yet. If eradication isn't practical because it's often just there, how do producers manage it long term? How do you live with it?
Since it's an opportunist and often part of the normal flora, the strategy has to be holistic, integrated, proactive.
Mm.
It's less about eliminating the bug itself and more about managing the risk factors that allow it to cause disease.
So focusing on the why it causes problems, not just the what.
Exactly. Key management practices are crucial. Biosecurity is number one, especially for those high-health, naive herds. That means careful sourcing of new animals, maybe from herds known to be free of clinical ASUs, strict quarantine and testing for arrivals, controlling traffic of people and equipment. The usual biosecurity pillars. All in, all out, AIAO, production flow is vital. Moving pigs in groups, emptying a barn completely, cleaning and disinfecting thoroughly before the next group comes in. This breaks the cycle of transmission between batches.
Makes sense. Break the chain.
Stress reduction is huge. Minimizing things like overcrowding, mixing pigs from different sources or ages, ensuring really good ventilation and air quality, stable temperatures, easy access to feed and water, anything that keeps the pigs comfortable and their immune system strong. And finally, controlling those co-infections, especially the immunosuppressive ones like PRRS. Having good PRS control through vaccination and biosecurity makes the herd much less vulnerable to secondary invaders like ASUs.
It really sounds like good general pig management is the best defense.
In many ways, yes. It's about building resilience in the system and minimizing the opportunities for ASU to exploit weaknesses.
What kind of hit do producers take financially when ASUS does break through? What's the economic impact?
It can be really significant. You've got the direct losses from mortality dead pigs, especially those young ones. That's lost income right there. Then the cost of treatment antibiotics aren't free. Neither are anti-inflammatories or the labor involved in treating sick animals. And then there are the indirect costs in the survivors. Pigs that get sick but recover often don't grow as well. They have poor feed conversion efficiency because maybe their lungs are damaged or they have lingering joint issues. So lower productivity. It adds up quickly.
Definitely sounds costly. So looking forward, what are the biggest gaps? Where does research need to go to help us deal with ASUS better?
Several key areas. First, we need better diagnostics. Ideally, rapid, accurate tests you could potentially use right on the farm, pen side, to quickly tell ASUs apart from APP and other lookalikes. That would allow for much faster targeted treatment. Second, and this is a big one, vaccine development. We really need effective, reliable commercial vaccines. Research needs to focus on identifying targets, maybe virulence factors that are conserved across different strains that can provoke a strong protective immune response. That would be a game changer compared to the current autogenous options.
A reliable vaccine would make a huge difference.
Absolutely. Third, we need a deeper understanding of its pathogenesis. We need to really dig into the molecular details, the genetics. What exactly triggers that switch from harmless commensal to dangerous pathogen? Understanding that better could open doors to completely new control strategies, maybe manipulating the gut microbiome with probiotics, or specific nutritional approaches to bolster immunity in those susceptible periods.
Thinking outside the antibiotic box.
Exactly. And finally, we need better surveillance. Comprehensive programs to track where ASUS is, what strains are circulating globally, how prevalent it really is, and very importantly, monitoring antimicrobial resistance patterns systematically. We need that data to guide treatment choices and preserve the effectiveness of the drugs we do have.
Wow. Okay, what a fascinating journey we've taken today. From this seemingly minor bug, ASUS, to understanding it as a major player, a disease of health in modern systems, unpacking its incredible mimicry, and seeing how control relies on this really integrated, proactive approach.
It's a perfect illustration, isn't it? How microbial life, herd health, and our production practices are all tangled together. ASUS really forces us to think critically about how managing one aspect of health can have unintended consequences elsewhere. It challenges those traditional views sometimes.
It really does. And it leaves you with a thought, doesn't it? Thinking about how adaptable these microorganisms are and how we're constantly changing farming and even human health practices. What other diseases of health might be out there just under the radar? What other surprises might emerge from our very efforts to create optimal conditions, challenging our assumptions about what healthy really means in these complex biological systems? Something to think about. As you go about your day, maybe consider how those principles we talked about holistic management, understanding complex interactions, looking out for unintended consequences, like with ASUS, how those might apply elsewhere, and in other systems, other parts of life where our interventions might be creating new challenges we didn't expect.